detailed secondary. First thing you want to do, you want to start with exposing the patient. You want to visualize and palpate. So starting at the head, you're going to be looking for Dcap Btls. I want you to run through that acronym: deformities, contusions, abrasions, punctures,
penetrations.
What's that?
Penetrations.
Oh yeah, burns, bruises, tendinitis, lacerations, and swelling. So then you're going to be checking the head. For all of those things, you're going to be looking for periorbital ecchymosis, which is signs of a basilar skull fracture. You're going to be checking the face and the mouth for any broken teeth, any blood in the mouth. You're going to next move to the neck, look for any tracheal deviation or jugular vein distension. You're also going to palpate the cervical spine behind the neck, at which time then you can put the cervical collar on. Next, you're going to move down to the chest. You're going to check the sternum for stability. We're going to Dcap Btls the chest. We're going to barrel hoop, checking for stability as well, looking for any foil segments or any sucking chest wound. Next, you're going to move down to the abdomen. We're going to be rolling and checking all four quadrants for distension, rigidity, guarding, or any pulsating masses. Next, you're going to go to the pelvis, and you're going to be checking for stability of the pelvis. You're going to check anterior to posterior, front to back, and lateral to medial, outside to inside. You're going to look for priapism, which is an indication of spinal cord injury. Offset pulse pressures, offset pressures, checking for Dcap Btls, any crepitus, any fractured bones, going all the way down both extremities, checking for PMSCs, checking for your pulse, motor, sensory, and circulation. I'm going to move up to your upper extremities. Same thing, offset pressures, checking for Dcap Btls, and pulse, motor, sensory, circulation. You're going to be checking for bilateral pulses, at which point we're going to communicate with the head person to roll onto their back or roll onto their side to check the back. We're going to be checking the back, Dcap Btls, any step-offs. Grab the wallet if possible, get patient information so that if they're unconscious, you're going to have another partner delegate sliding the backboard in. And then on the headman's count again, you're going to roll them back down. If at any point during your detailed secondary assessment you find anything that needs to be addressed treatment modality-wise, you will address it, or you should address it then and there.
Cool.
Yep.
Great.
All right, so I try to go kind of slow.